Welcome. We're just going to have a small discussion. My name is Dave Mendonça. I'm here with Tony Saw. We'd just like to inform you to get a better idea of what COVID-19 is. So a lot of people have been calling this COVID-19, but really it's caused by a virus. This virus is the novel virus, meaning new, SARS coronavirus 2. So it's sort of like if you have HIV, the disease is AIDS. For SARS CoV-2, that's the virus, and when you get the illness, then it's called COVID-19. Have you had a lot of people kind of considering both the same, like COVID-2 and SARS and COVID-19 being the same?
No, the people I've been experienced with. But I'm in a very rural community in Kula where they're not too familiar. Some people have compared it to like a flu virus, but a more severe flu virus. But there's a big fear out there. There's a big fear that this is going to kill everyone, but I don't think it's getting to that point right now.
Well, the fear is pretty real. It's because we are not very sure, and the data is still being collected. So what we do know about this SARS CoV-2 is that it apparently did come back from a bat. And then it somehow became more virulent and was able to be transferred into human beings. And this is where it started in Wuhan, China. And now it's a pandemic, right? It's spread everywhere. And we see the numbers for Hawaii and Maui County specifically. These numbers have sort of plateaued, and what they said was kind of tapered off. It's brought down the amount of individuals or patients that are diagnosed with the COVID-19 as a result of being infected by the SARS CoV-2 virus. And it's decreased the amount of positives that we see daily. This lessens the burden on our EMS providers as well as the hospital and healthcare facilities and partners. So it makes this event much more manageable. Do you hear any issues with patients not wanting to seek help or call when they might have a serious problem?
Yes, that's increased. Now they're waiting longer, but it's actually there's been good and there's bad, because now there's people that they realize that, oh, I really don't need an ambulance for minor things that I can take care of myself. And then there's the other extreme side where people don't want to call us because they don't want to go to the hospital, or they don't even want to be around us, especially when they see us wearing masks and respirators and full geared up. So they kind of have a fear that they don't want us in their home also, which is not good, because sometimes I've already had a few cases where we had to convince the people that, yeah, you need to go to the hospital. This has nothing to do with coronavirus. And then their fear is like, well, I'm going to catch it at the hospital. No, it's already been it's been around a while now. There's a better chance that you won't catch it because they've already determined how to isolate certain cases. It's not 100%, but now it's at least the education is out there, the knowledge is out there. So some people do need to call for when they have severe symptoms of anything, chest pain, stroke stuff.
All right, yeah, I agree. So don't stall. Call 911 for your emergency needs. The protective posture, the mask, those gowns, the face mask, the things that we're using, it's to protect you as well. And that's why public's been told to wear face coverings to prevent the cross-person spread. I mean, you're using it to protect others. We're using it to protect ourselves against everyone, but we're doing as much as we possibly can to minimize the spread of the SARS CoV-2 virus, and so that you don't get COVID-19. All right, thank you.